It's Joss from Nature's Graces again. Thank you so much for joining me here. Today we are going to be talking about a topic that I think all moms can relate to. New, old, maybe you're not even a mom yet. It's definitely something you want to be looking at and being mindful of and being prepared for. And that is teething with our little one. It's such a difficult time for baby and for mom because it can be quite confusing. You're not sure, is my baby actually teething? What is happening? What is associated with the teething and what isn't? What is completely separate from it? And there's a lot of questions around this. And so today we're going to look at how we can support our baby with some natural remedies. Okay, so before I go further, I do want to chat about a baby's immune system and something that happens around the 6-month mark. So babies acquire their immunities from their mother while they're in the womb. And at around 6 months, this starts diminishing and the baby's own immune system starts becoming a bit more established. And often this is when a lot of kiddies start teething. So sometimes there's little infections or little fevers that are just based on the baby, building its immune system, and we link those with teething, and it's not always the case. So it's just something to be mindful of. I know not all babies teeth around 6 months. Some babies are born with a tooth or two. I know my oldest was 1 when she pushed her first tooth. So really, it is so different for all of our little ones. But what we do want to look out for, and as I said, it isn't always linked with teething, but sometimes teething does come with a set of symptoms. Not always, but sometimes 1, 2, 3 may present themselves. So just some things that we're going to be looking out for are drool, a lot of dribble, saliva around the mouth. This sometimes also creates a rash that becomes present around the mouth area, sometimes onto the chest, as well as into the diaper or the nappy region. Because of the saliva going to the tummy, it sometimes can cause diarrhea, and that can cause a rash in that area as well. So just, looking out for that. The very obvious swollen, red, inflamed gums, that looks really painful. You can see it if you have a look at it. You can almost feel it if you touch with your finger. And, along with that, often babies are trying to just stick anything in their mouth just to be able to chew. So giving them a nice cold teether or some baby biltong is nice for them to chew on. That can also be a developmental thing. So just be mindful, if they're starting to chew a lot, doesn't necessarily mean that they're teething. They do go through that as they're growing. Oftentimes, that if you're suffering from, any ache in your mouth, it does affect the ears. So sometimes they'll be tugging and pulling and scratching at their ears. Just, that painful presentation in the ear area is also something to watch out for. What can we do about it, right? Obviously, we just want to love on them. That's first prize. If you're not feeling well, that's what you would like. So, give them those extra cuddles. And then going from there, I have 3 essential oils that we're going to blend together that are they work a charm. And that is our Roman chamomile. Chamomile is amazing. So you can, even if you're making chamomile tea, baby chamomile tea, if you can give them some of that, depending on their age, just check for that. So Roman chamomile, copaiba, and lavender, my all-time favorite mommy oil. And we're going to blend that together in a roller bottle. You can have a look. There's a free dilution chart or guide below that you can click on and have access to. But always, less is best. And if you're not finding it helpful, you can add more essential oils into that mix. But those 3 together are going to just help soothe the area. What you're going to do is you're going to take the roller bottle along their cheek line up to the ear, and then along their jawline to behind the ear. And you can massage that in gently to help relieve that pain. If you're still finding it's not really working, I would take some oil, even if it's neat, and some lavender, copaiba, and just dab it onto the gums directly. It's not going to taste great for the baby, but in my experience, the store-bought options are also not great tasting. This really worked. The dabbing of neat lavender really worked for my second born. So looking forward to trying it out with the next baby. From there, sometimes what we do find is obviously those secondary symptoms presenting themselves. So let's have a look at those briefly. I do cover them in other videos, so you can have a look out for fever, and tummy issues. So if your baby is presenting a fever with it, you can also dilute lavender and peppermint together and rub that along the back of their neck and down their spine. What I do find is that it brings down their skin temperature, so the feel of their bodies really reduces. If I take their temperature, it still isn't down to a normal range, but that's fine with me as long as it's out of a dangerous range. Although teething, there's usually a fever, but it's not usually up into a dangerous level. So don't panic about that too much. If your baby is tugging in the ears and it does look like there's a bit of earache, tea tree and oregano, diluted again and applied behind the ears and massaged around that area is going to be helpful just to relieve the pain and anything that's going on there. But that roller that helps reduce the inflammation in their gums is going to be first prize. And then obviously with the rash that they might present, if it's on their face and on their chest, you're going to use a little dropper bottle. So it's diluted with some jojoba oil because that's really nourishing, frankincense, lavender of course, and tea tree. The tea tree is very potent, so just be careful with it. You don't want it to be causing more irritation to the area, so really use a tiny bit of tea tree. It's going to help destroy any bacteria that might be growing in those regions or those areas. The lavender is going to help soothe that area and just reduce any inflammation or redness, and the frankincense of course will help to renew the skin cells there. If the rash is in the diaper area, I would suggest using a spray bottle. It's really nice. You can just spray it onto that area and you don't even have to touch it, because you know an area that's sensitive already now has a rash, and now we're going to touch it even more. So just to reduce the amount of actual physical contact there. Through us, the spray bottle is very helpful, and I would do the tether along with the spray every single nappy change. If there's no rash, then obviously leave that out. But yeah, that is it from me today. If you do have anything that you've tried that's worked, or if you have any suggestions for us, please pop them in the comments. I love learning from you guys as well. And yeah, I'm so grateful that you have been here today. Thanks so much for watching.